thank you, Duane, very, very much. I wish my mom was alive to hear it. Well, thank you very much, very gracious, and thank you, Mark, for hosting us today, and to all the board members. I was asking the board members how long they've been on the board, and I got 18, 16, 17, so it sounds like they're lifers here. So, it's a good continuing. So I'm really pleased to be here, and also to be here with Catherine and Grant Davis, who is the CEO of the New Jersey Primary Care Association. Where are you, Catherine? You're all dressed in white. There you go. She does a great job of advocating for all of you, and I understand that Caitlin McCullough is Director of Federal Affairs for the National Association of Community Health Centers here as well. So it's good to have you up here. I have been to so many of our federally qualified health centers in the state. As a huge champion of them, I believe in what you do each and every day. I haven't been here, and it's really a gorgeous place, and it is spotless, which always reminds me of the type of image that we want to give to people who come here for their quality of care. So it's just a fantastic opportunity to kick off the week. I appreciate all of the people who work here. I understand that there are 8 of you who have completed a quarter of a century. Sounds really a long time to say that. 25 years, but a quarter of a century. I'm going to recognize you in a few moments, but I wanted to first say I think we're here today for several reasons. We kick off National Health Center Week, and we stand together as we always have for affordable care for every child, every mother, every father, every family in our state here in New Jersey. We have stood together side by side on a whole host of issues, increasingly trying to improve and enhance the role of federally qualified health centers that provide citizens with access to high-quality, cost-effective, affordable health care. And I'm pleased that in the new health care law that President Obama signed, my advocacy to make sure that federally qualified health centers requires, the law requires private insurers to pay federally qualified health centers and reimbursement in full in the new exchange is part of the law of the land, because we believe that to provide the services, but to get reimbursed for those services from the companies in the exchange. And we accomplish that by extending what we call the PPS payment rate to insurance plans participating in the exchange, so that federally qualified health centers like CAMcare and the 300,000 New Jerseyans they serve can continue to provide quality preventative care, patient education, and effective case management for those with chronic conditions at more than 100 community health centers like this one across the state. I also appreciate very, very much that you all have joined with us for several years now in having our Children's Health Day initiative that provides immunizations, dental care, vision screenings to uninsured and underinsured children in our community. You know, we say as a society that children are our most important assets. And at the same time, they are our most vulnerable asset. And so making sure that they have the opportunity to fulfill their God-given potential, which comes with good health in the first instance, is incredibly important. And this is the 3rd consecutive year that my Barrington office has joined with you in co-hosting Children's Health Day. Last year, over 100 children attended the health outreach event, and certainly we're thrilled with that and hope to see that many or more this year. That's happening today from 10 to 12 here, and from 11:30 to 3:30 at the Southern Jersey Family Medical Center in Hamilton. So I'm grateful to CAMcare for taking the initiative and working with us on Children's Health Days. I don't think we can overstate the importance of community health facilities like CAMcare, the good work you have been doing since 1978 to provide quality health services to uninsured and underserved families regardless of their ability to pay. And I think that finally, I'm thrilled when we often ask, well, did the Recovery Act that President Obama joined with Democrats in the Senate and in the House pass, does it make sense? Did it really do things to move our economy? You know, our economy was flatlined. And if you think of a heart monitor, you visit someone at the hospital, maybe you have one here, and it's beating rhythmically, you know that's good. When it is flatlined, you've got an emergency on your hand. And in essence, that's where our economy was when we took office last January, and the president took the office of the White House. He had an economy that was flatlined. And the question is, how do you go from having stopped the country to go into a new depression, which is what was going to happen at the end of 2008, where financial institutions were on the verge of collapse in our country, and their collapse would have created an entire risk to our entire economy, and therefore to each and every one of us, to stop that from happening, and then yet still, having fought off a new depression in our country, find ourselves with an economy that was flatlined, was losing 750,000 jobs in January and February and March of 2009, had us in negative GDP growth. That means that instead of growing, we were recessing. And go from that and try to create a stimulus in that economy with the Recovery Act to create jobs, so that while we are creating jobs, and have created over 600,000 jobs this year alone, it's not going fast enough for what we want to get people to work. But it's a dramatic turnaround from losing 750,000 jobs each month of January, February, and March of 2009. That alone was over 250,000 jobs lost. So we are, what am I saying, 2 million jobs lost. So this is what we face. And so the Recovery Act was to try to get people to work, but also to do it in a way that was smart. And so we're really thrilled that under the Recovery Act, CAMcare has received almost $1.4 million in a capital improvement money to make the improvements you need to expand your ability to provide quality primary care and preventative services to the community you serve, and another $457,000 to add 19 full-time providers and support staff to bring adult and pediatric services to Paulsboro and Clemington. So we're getting people to work. We're doing it in ways that are going to help people improve the quality of their lives, be more productive, be able to fulfill their God-given capabilities. And finally, the new healthcare reform legislation that the President signed into law, which I was privileged to help write as a member of the Senate Finance Committee, provides $11 billion in new funding over 5 years to help healthcare centers expand their operations. So between that and being able to improve our services and improve the locations in which we deliver these services, at the end of the day, what I never lose sight, and I am sure you never lose sight, and certainly all of those who have served here for 25 years or more, although I think looking at the list of people who served here 25 years, they must have dropped you from the crib to begin working here. Is that this is about people. It's not about the structure, not even really about money. It's about people. It's about lives. It is about being able to improve the lives. It is about being able to take someone who is ill and make them well. It is about able to detect someone who may have an illness they don't even know and be able to help them cure them. It is about improving lives, saving lives, and that is the greatest gift that one can do, whether you're at the administrative end, or whether you're at the delivery end, or whether you're at the legislative end, to try to make it all possible. I think that's really what we celebrate during this National Week of Federally Qualified Health Centers, what we celebrate in the work that you do each and every day. I hope you never lose track of that, because in our daily lives, it's so easy to get, in the mix of numbers of people and moving and patients and whatnot. But what we're really doing is turning people's lives around. So when you do that, that's the greatest gift you can give in any career. So thank you very much for